Welcome to today's CT Style Express. I'm Natasha Lubchenko. A new state-of-the-art imaging device is being used for orthopedic surgeries at Middlesex Health. Doctors say it's making a positive impact on surgery outcomes. Joining me now to talk more about it are spine surgeons Dr. Joseph Sohn and Dr. Jeffrey Bash. Doctors, thank you both for joining us.
Thank you.
So Dr. Sohn, I want to start with you. Could you tell us about this new imaging device that you're using at Middlesex Health?
Yes, this new imaging device is a portable, sophisticated CT scan that could be used in the operating room setting.
And now, Dr. Bash, how does this compare to what was previously used for these types of surgeries?
Thank you. Yeah, this new imaging technology is really revolutionary in terms of allowing the surgeon, the spine surgeon, Dr. Sohn and myself, and other spine surgeons that will eventually have this technology available it basically enhances your ability to image or view the spine and the different complex components of the spine in 3 dimensions. So this allows us to perform more surgeries in a minimally invasive manner, and it significantly reduces the time spent putting various hardware that we need to put in the spine to correct conditions like herniated discs and slip discs and scoliosis. So in the past, in order to be able to achieve what this technology gives us, it would require 3 different components. And this allows all 3 of those different components to be in one actual technology. So to elaborate, we use intraoperative fluoroscopy, which is a 2-dimensional imaging to be able to guide us, myself and Dr. Sohn, where we put the hardware in the spine for safety and maximum accuracy. What also we can do in certain cases is combine that with a robot to help us place the hardware, which is becoming more commonplace. But this also combines an intraoperative CAT scan, also known as a CT scan, all in with those 3 technologies. Whereas before this, we would have to bring in 3 different components in and out of the operating room to do that. So not only does it save time, but with the new software and technology, the imaging quality is exceptional. It's not even to compare.
Wow.
So, yeah.
And Dr. Sohn, you mentioned the types of patients who might benefit from us. Could you walk us through, the types of surgeries that this could really benefit?
Sure, of course. Many patients that require spine surgery do require spinal fusions when we unite bones together. And these typically are patients that have what's called spinal stenosis, instability and deformity, which cause not only just a lot of back pain, but leg pains with numbness, tingling, and occasionally weakness. So a lot of times we need to stabilize the spine, and in order to do so, we have to place, as Dr. Bash had mentioned, these applications such as screws and rods, obviously in a very delicate area. Excuse me. And the way that the imaging now can help us is pretty much in 2 folds. We can use it either before the surgery or after surgery. And it also is a very convenient factor for the patient, because in the past, we used to place these pedicle screws. And sometimes if there was any question about whether there's any concern about misplacement or not being in an ideal position, then we would have to wake the patient up, bring them to the CT suite, and then check it. And if there's anything that needs to be done, they would have to be brought back to the operating room. Now, with this, we could check the imaging while the patient's under anesthesia, so they don't need to be brought out and have that inconvenient factor brought on to them. Also, what we like to do is, as Dr. Bash had mentioned too, that we use a lot of robotic navigation. And again, with robotic navigation, it's a very accurate surgery to place these screws. However, they need a CAT scan or a CT scan before the operation. But now with the 3D imaging that's done, which could be conveniently done in the operating room, the patient could be under anesthesia, could obtain the imaging, integrated with the robotic navigation system so that we can plan the surgery better.
Yep.
And at the same time, not inconvenience the patients.
So it saves patients time in the operating room. It's more accurate. Seems like there's a lot of applications here. Beyond spinal surgery, I know it can go into other orthopedic surgeries as well. Great information. I do want to tell people where they can learn more. It's middlesexhealth.org/orthopedic-services. Dr. Joseph Sohn and Dr. Jeffrey Bash, thank you for the information today.
Thank you very much
Thank you
for having us.
All right, and that's it for today's CT Style Express. Thanks so much for watching. I'm Natasha Lubchenko. We'll see you right back here tomorrow.